Welcome to Nursing P.A.L.S, where we learn together, share stories from the heart, and work as one towards better healthcare. Haven't hit subscribe yet? Please do. It helps us grow and keep making awesome videos for you. Thanks for being with us.
Welcome everyone to a new educational video where we seek to simplify complex medical concepts. Today we're going to delve into an intriguing and fundamental topic: intracranial regulation. This subject may seem intimidating, but we're here to break it down and make it digestible for you. Whether you're looking to brush up on your medical knowledge or are just naturally curious, this video is designed to be an informative and engaging guide. Before we get started, it's important to clarify that our content is intended for educational purposes only. It's not a substitute for professional medical advice. For any health concerns or questions, we strongly recommend consulting with a licensed healthcare professional. They can provide the personalized guidance you need to navigate health matters responsibly. So, buckle up as we dive into the world of intracranial regulation. Intracranial regulation may sound like a mouthful, but it's simply about how your brain manages its pressure levels. Intracranial regulation, in essence, is the body's way of maintaining a delicate balance within the skull. It's a balancing act between three components: brain tissue, blood, and cerebrospinal fluid. Imagine your skull as a fixed box. Now, if any one of these components increases in volume, the others must decrease to maintain the same pressure. This is known as the Monroe-Kelly doctrine, a principle that forms the basis of intracranial regulation. But why is this regulation so important? Well, the brain, as we all know, is a vital organ that controls our body's functions. It needs a constant supply of oxygen and nutrients delivered via blood flow. Any disruption to this flow, such as an increase in intracranial pressure, can lead to brain damage or, in severe cases, death. To avoid this, the body employs several mechanisms to regulate intracranial pressure. One such mechanism is the autoregulation of cerebral blood flow. This means that the brain can adjust the diameter of its blood vessels to maintain a constant blood flow, even when the body's overall blood pressure fluctuates. Another mechanism involves the cerebrospinal fluid, which cushions the brain and spinal cord. The body can adjust the production and absorption of this fluid to help regulate pressure within the skull. Now that we have a grasp of what intracranial regulation is, let's delve into its alterations. Like any other process in our bodies, intracranial regulation can also face hiccups. Indeed, alterations in intracranial pressure regulation can lead to serious health problems. But how does this happen? Well, let's dive into the pathophysiology of this fascinating system. Intracranial regulation is all about maintaining a delicate balance. The skull, home to our brain, is a rigid structure with limited space. This space is filled with three components: brain tissue, cerebrospinal fluid, and blood. The total volume of these components must remain constant to maintain normal intracranial pressure. This is what we call the Monroe-Kelly doctrine. When something disrupts this balance, the body initially compensates. For instance, if a brain tumor grows, the body might reduce the amount of cerebrospinal fluid or blood to maintain normal pressure. However, if the disruption continues and exceeds the body's ability to compensate, intracranial pressure can rise, leading to a condition known as intracranial hypertension. This increased pressure can compress brain tissues, impairing their function. It might result in symptoms such as headaches, nausea, vomiting, and altered levels of consciousness. If left unmanaged, it can lead to severe complications like brain herniation, where parts of the brain are squeezed out of their normal position. On the flip side, a decrease in intracranial pressure or intracranial hypotension can also occur. This might be due to a leak in the cerebrospinal fluid, often resulting from a lumbar puncture or a traumatic injury. Low pressure can cause the brain to sag, leading to symptoms like a positional headache, which gets worse when standing and improves when lying down. So you see, whether it's an increase or decrease in intracranial pressure, both can lead to significant alterations in brain function. It's like walking a tightrope, with the body constantly trying to balance and maintain normal pressure inside the skull. Understanding these alterations helps us recognize the risk factors and the need for prevention. By staying vigilant and proactive in our understanding of intracranial regulation, we can contribute to healthier, happier brains. Prevention is always better than cure, isn't it? Let's take a look at how we can stay ahead of the game when it comes to intracranial regulation. For starters, maintaining a healthy lifestyle is crucial. Regular exercise, a balanced diet, and adequate sleep can go a long way in keeping your brain healthy. Avoiding harmful habits like smoking or excessive alcohol consumption can also reduce the risk of intracranial regulation disorders. Moving on to risk factors, several things can increase your chances of experiencing issues with intracranial regulation. Age is one, as older individuals are more susceptible. Conditions like hypertension, diabetes, and obesity can also play a role, as they can lead to changes in blood flow to the brain. Trauma to the head or neck can directly impact intracranial regulation, as can certain medications and substance abuse. In terms of findings, symptoms can vary greatly depending on the specific issue at hand. However, some common signs to watch out for include headaches, changes in vision, loss of coordination, and cognitive issues like confusion or memory loss. More severe symptoms might include seizures, unconsciousness, or even changes in personality or behavior. Remember, these symptoms don't necessarily mean there's an issue with intracranial regulation, but they are indicators that something might be wrong. If any of these symptoms arise, it's important to seek medical attention promptly. With this knowledge, we can better understand how to diagnose these issues. And that's the first step towards effective treatment and management. Diagnosis is a vital step in managing any health concern. When it comes to intracranial regulation, a combination of clinical assessments, laboratory tests, and diagnostic procedures are employed to get a clear picture of what's going on inside the skull. Firstly, a physical examination can provide initial insights. This involves assessing the patient's neurological status, checking for changes in consciousness, motor responses, and vital signs. In terms of laboratory tests, blood samples can be analyzed for signs of infection or inflammation, which could suggest an underlying issue affecting intracranial regulation. Next, we delve deeper with imaging studies. Procedures like computed tomography or CT scans and magnetic resonance imaging or MRI allow healthcare professionals to visualize the brain and surrounding structures. These scans can reveal abnormalities such as tumors, bleeds, or swelling, aiding in the diagnosis. Another critical diagnostic procedure is a lumbar puncture, also known as a spinal tap. This procedure involves extracting cerebrospinal fluid from the lower back, which can then be tested for signs of infection, bleeding, or other neurological disorders. Last but certainly not least, an electroencephalogram or EEG might be used. This test measures electrical activity in the brain, potentially identifying issues like seizures or other neurological conditions. These diagnostic tools, used in conjunction, provide a comprehensive overview of a patient's intracranial health, guiding the course of treatment. After diagnosis, the next step is to ensure safety and provide care. Safety, as they say, is no accident. And when it comes to intracranial regulation, this couldn't be more accurate. Let's dive into the safety considerations and nursing care related to this crucial aspect of our health. Firstly, we need to understand that managing intracranial pressure is a delicate process. It's essential to maintain a patient's safety by closely monitoring their neurological status. This includes keeping track of vital signs, level of consciousness, and pupil reactivity. Additionally, nursing care plays a pivotal role. Nurses need to implement strategies to reduce intracranial pressure, such as positioning the patient's head in a neutral position and avoiding activities that could increase intracranial pressure like coughing or straining. Pain management is another crucial aspect. It's important to keep in mind that pain can elevate blood pressure, leading to an increase in intracranial pressure. Therefore, effective pain management strategies are vital. When it comes to nutrition, a balanced diet rich in protein and vitamins is necessary to support healing and prevent complications. Nurses also need to ensure adequate hydration without causing fluid overload, which could exacerbate intracranial pressure. In the case of invasive procedures, strict aseptic techniques must be followed to prevent infections. After all, an infection can lead to inflammation, which can further increase intracranial pressure. Remember, each patient is unique and requires individualized care. The goal is always to prevent complications, maintain safety, and promote recovery. And now, onto the medications used for treating these conditions. Medications are powerful tools in our healthcare arsenal. They can make a significant difference in managing and treating disorders of intracranial regulation. Let's delve into some of these key medications. First, there are corticosteroids, like dexamethasone. These reduce inflammation and swelling within the brain, making them crucial in treating conditions like brain tumors or severe head injuries. However, they should be used judiciously, as long-term usage can have side effects. Next, we have anti-seizure medications, such as levetiracetam. Seizures can be a common symptom of intracranial disorders, and these drugs help control and prevent them, ensuring a better quality of life for patients. Diuretics like mannitol are another key player. They help reduce intracranial pressure by decreasing fluid volume in the brain. Now let's talk about client education. It's not just about taking the right medication. It's about understanding why and how to take it. Clients should be informed about potential side effects and what to do if they occur. They need to know the importance of adherence to medication schedules and the risks associated with abruptly stopping medication. Moreover, they should be educated about lifestyle modifications that can aid in managing their condition, such as regular exercise, a balanced diet, and avoiding triggers like stress and alcohol. Remember, the goal is to empower clients to take an active role in their healthcare journey. With medication in place, let's look at interprofessional care. Healthcare is a team effort. In managing disorders of intracranial regulation, collaboration among healthcare professionals is key. Neurologists, neurosurgeons, nurses, and pharmacists all play crucial roles in ensuring effective treatment. Neurologists and neurosurgeons diagnose and treat the disorder, while nurses provide ongoing care and monitor the patient's condition. Pharmacists, on the other hand, ensure the right medications are delivered in the correct dosages. Intracranial regulation disorders can have serious complications if left untreated. These may include cognitive impairments, physical disabilities, and in severe cases, life-threatening conditions such as brain damage or stroke. Early detection and prompt treatment can significantly reduce these risks. Managing these disorders also involves educating the patient and their family about the condition. The healthcare team works together to provide information about the disorder, treatment options, and ways to manage any potential side effects of medication. This collaborative approach helps ensure the best possible outcomes for patients. Now that we've covered the bases, let's summarize. Knowledge is power, and it's time to consolidate ours. So, let's recap. Intracranial regulation is a delicate balance that keeps our brain functioning optimally. When disrupted, it can lead to significant health alterations. The pathophysiology of these changes is complex but crucial to grasp for better patient care. Remember, prevention is key, and understanding the risk factors can help us identify potential issues early on. Diagnostic procedures and tests play a vital role in confirming any irregularities. Safety considerations and nursing care are essential to manage this disorder effectively. Medications are tailored to the specific needs of the patient, and appropriate client education is paramount to ensure adherence to treatment. Interprofessional care is the cornerstone of managing complications. Remember this mnemonic IPDSMI, standing for intracranial regulation, pathophysiology, diagnosis, safety, medication, and interprofessional care. It'll help you remember the key points. Remember, understanding is the first step to mastery. Keep learning. Until next time, stay curious and stay healthy.
Thanks for watching. Love what you see on our channel? Consider buying us a coffee. Click on the link below for more. Your support goes beyond just a caffeine boost. It's a vote of confidence that fuels our passion and dedication to delivering the best content possible. Together, we can make each video even better and continue to grow and improve. Much love and gratitude from all of us at Nursing P.A.L.S. Don't forget to like, comment if this was helpful, and subscribe.